Welcome. A 55-year-old postmenopausal lady presented with complaint of bleeding per vagina for 2 months duration. Per speculum and per vaginal examination showed an infiltrative growth at the posterior lip of the cervix. Cervical smear was taken and stained. So below you are seeing the image of the cervical smear, that is the PAP smear. So here is a 55-year-old female who presented with bleeding per vagina. Duration is 2 months, and on examination they noted a infiltrative growth at the posterior lip of the cervix. So history wise we can tell that there might be some growth in the cervix. It can be a tumor. So for further confirmation they have gone for pap smear. So this is the image of the pap smear. So where you are able to appreciate few things. Since it is black and white, you are not able to appreciate properly. But here you are observing two things. One, inflammatory cell, another malignant cells. So always when pap smear is given, you should look into the components present in the pap smear. First you should check for the adequacy of the smear, whether cells are enough to get reported or any other abnormal cells are there in the smear. You should look into the components. So first you should see the cells. Okay, what are all the different cells present in the smear? Then you should see the background of the smear. How is the background? Then finally you have to report it. There are few questions here. What is the method of reporting a cervical pap smear, and mention the protocol? So the method of reporting cervical pap smear is known as Bethesda system. Bethesda system. And there is a protocol for that. Okay, so there are few headings under which a pap smear should be reported. So that is a protocol of reporting. So that we will see one by one. First we will see the normal components present in a pap smear. What all you should see normally in a pap smear. So whenever pap smear is given, first you should check the adequacy of the smear. What do you mean by adequacy of the smear? That is nothing but minimum number of well visualized squamous cells present. There is one criteria or cutoff for that. These many numbers should be present in the slide to call it as adequate. So that is called as adequacy. So before going into the number, we know that there are two types of preparations. One is liquid based preparation, that is a modern method. Another is an old one, that is conventional preparation. So what is the difference between these two preparations? In liquid based preparation, liquid medium is used, okay, as a fixative medium, as a preservative medium. A liquid medium is used, and after collecting the pap smear, that brush is placed in this liquid. Okay, then the slides are prepared. And while for the preparation of slides also, automated methods are used in liquid based preparation. So the liquid mediums are based on the methanol based, ethanol based mediums. Okay, different mediums are available. So thin prep and sure path, they are nothing but the brand names of this liquid based preparations. These are the brand names. So there are few steps. Okay, after following these few steps, the slides will be prepared and finally they will be stained for pap. That is, pap staining is done, then finally it is reported. So liquid based preparation, why it is preferred means it is giving a clear background. It will remove the debris present. Okay, maybe the mucus, blood, these debris will be removed by in the liquid based preparation when compared to conventional. But conventional will have lot of debris, and the uniformity of the cell is also preserved in liquid based preparation when compared to conventional. Okay, so what is the minimum criteria? Okay, that is the cutoff of squamous cells. For liquid based preparation, minimum 5000 cells should be present. For conventional, that is a usual what we will do for that, 8000 to 12000 cells should be there. Usually we don't count the cells, but it is just a approximation, estimation. One more thing you should consider in the slide, that is the background. If at all some obscuring thing is present in the background, there might be bleeding while taking the pap smear. Okay, so blood might be present. There might be some secretions coming out of the vagina. So some mucus material may be there. These are all the obscuring material present in the slide. So if that obscuring material is obscuring more than 75% of the field, then that particular slide is unsatisfactory. You cannot report on such slides. Okay, so that becomes unsatisfactory. So if that obscuring material is there more than 75%, then again you have to repeat the pap smear. Next, coming to the quality indicator. This is not mandatory like it should be present, but if it is present, then it is good. That is a quality indicator. Which are the cells? Squamous metaplastic cells and endocervical cells. Any of these, okay, any of this, if equal to 10 or more than 10 of these cells are present, then we can tell it as it is a good quality indicator. Okay, that's the procedure of taking pap smear was right and adequate material is taken out. For abnormal cells, see, I told more than 75%, if obscuring is there, then we have to repeat. If at all even one abnormal cell is present in the smear, okay, just one cell is there, that is abnormal, then you have to definitely report such slides. Okay, any specimen with abnormal cell is considered always adequate. Okay, and it should be reported. Even though it might be 1 or 2 cells, we have to consider it. Okay, so what are all the components of the normal pap smear? That is nothing but the cells present in the cervical lining. You know, cervix is made up of 2 parts. One is ectocervix, another is endocervix. So when you are taking pap smear from the cervix, the cells will be coming from ectocervix as well as endocervix. Okay, so there are 2 components. So from ectocervix, what all you will be getting? One is a superficial cell. Next is a intermediate cell. Next is a basal cell. Okay, that is coming from ectocervical part. You know the layers of the cervix. Okay, that epithelium of the cervix is nothing but a stratified epithelium with these layers: basal layer, intermediate layer, superficial layer. These cells will come in the ectocervical part. When the brush reaches endocervix, from there endocervical cells come. Now we will see how these cells will appear on the slide. Okay, first one, superficial cell. How to identify a superficial cell? Okay, superficial cell is nothing but it is a cell which is a polygonal cell with a small pycnotic nucleus. Okay, here you are seeing. Okay, that is a superficial cell. Abundant pink cytoplasm, orangeophilic cytoplasm because of that keratin content. Okay, so such cells are called superficial cells. Whenever estrogen is in excess, high amount, superficial cells will be more. So you should think which are all the conditions where estrogen is high. During mid-ovulation phase or during the pregnancy time and all, you can find these cells. Okay, superficial cells. Next, coming to the intermediate cell. They are also polygonal cells, okay, with abundant blue cytoplasm, round to oval nucleus. And this is very important cell because always intermediate cell is a reference cell in the pap smear. All the other cells are compared with this intermediate cells. Okay, so it is a reference cell. So again, estrogen is responsible for intermediate cell. In pregnancy, if women is taking oral contraceptives, which estrogen based hormonal therapies, we can see more intermediate cell. Okay, it's a reference cell. So all other cell nucleus, everything is compared. Nucleus is compared with intermediate cell. Other cell nucleus will be compared with this intermediate cell. Next, coming to the basal layer, that is a basal cell with minimal cytoplasm, round to oval nucleus. So that is a basal or parabasal cell. Fine but slightly dark chromatin. So when this will be present? When hormonal effect is low, basal, parabasal. That is in the postmenopausal women, it will be more. Okay, basal and parabasal cell, because it is a mature below layer, the immature layer, the lower layer. Okay, so that is without hormones, these cells will be more. That is in the postmenopausal, that is atrophic smear. If basal cells are there, then we can call them as atrophic smear. Next, coming to the glandular component. In glandular component, you have endocervical cells. How these endocervical cells appear in pap smear? Either in the honeycomb pattern or in the palisaded pattern, that is fencing pattern, they are present. Okay, they are columnar cells with round to oval nucleus placed at the bottom, that is polar location. They can be either palisading or they can be honeycomb. Okay, so these are the endocervical cells. Next, coming to the endometrial cells. So normally, if at all the premenopausal women, then in the first half of the menstrual cycle, we can expect normally endometrial cell. If at all these endometrial cells are present in women above 50 years, then it is of concern. We should be careful, because after 50, like after menopause, if the cells are there, then we should think of some hyperplasia or some malignancy. So you have to be careful. How these cells are? Endometrium, they are small cells, high NC ratio, nucleus same as a cell as that of the intermediate cell, round with small chromatin, possible micronuclei, and they'll be present in large groups. Okay, outside will be kind of epithelium kind, but inside part look like a stroma. Okay, so this is the endometrial cell. These are few normal components present in the pap smear, that is superficial cell, intermediate cell, basal cell or parabasal cell, endocervical cell, endometrial cell. And one more thing we saw, that was squamous metaplastic cell. So they can also be present. Okay, so if they are there, then it is a good quality indicator. So these are the few normal components of the pap smear. Next, we will go to the questions. What is a method of reporting cervical pap smear, that is Bethesda system? Describe the stages of cervical cancer from stage 0 to stage 4. We can describe. Stage 0 means carcinoma in situ. It is not breached the basement membrane, or we can call it as SIN3 or HCIL. Stage 1 is nothing but carcinoma confined to only cervix. In that stage 1A, it is a preclinical carcinoma which can be identified only by microscopy. Next, stage 2 means carcinoma is going beyond the cervix but not to the pelvic wall. It is limited to the upper part of the vagina, that's all. Stage 3 means carcinoma is extending to the pelvic wall and it is involving the lower third of the vagina. Stage 4 means it is gone beyond the true pelvis, or it has involved the mucosa of the bladder and rectum. This stage also includes cancers with metastasis. Okay, so this is a staging of the cervical cancer. They have also asked about the protocol. So what are the headings under which pap smear should be reported? One is specimen type. Type means whether it is liquid based preparation or whether it is a conventional one. Specimen adequacy. Already I told number of cells. Liquid based preparation, it is 5000 cells. Conventional, it is 8000 to 12000 cells. Then you should see the background, that is obscuring material. If it is more than 75%, then it is not adequate. It is unsatisfactory smear. Okay, that obscuration. If it is less than 75%, then you can report it. Then quality indicator, as I indicated, endocervical cells and squamous metaplastic cells, okay, can be considered. Then you should see the normal cells present, which is a predominant normal cell, whether it is superficial cell, intermediate cell or basal cell. Accordingly, we will report it. So if it is a normal healthy female reproductive age group and all, superficial intermediate will be there normally. So that should be reported, which is predominant, that should be reported. Then if it is a postmenopausal lady, no hormones, then parabasal cells will be more. Then you should report it as atrophic smear. Parabasal cells are more. Then you should see the background. Usually it will be clear with some Dodderline bacilli normally, ideally. If at all any inflammation is there, then inflammatory cells, that is neutrophils or lymphocytes, you have to see. Along with that, organisms you have to see. Any bacteria vaginosis, like Coccobacilli is there, Trichomonas vaginalis, then Candida, all these things you have to observe in the background. This is how background should be seen. And also any material in the background like blood, mucus, that also should be seen and reported. Next, reactive changes. If any nuclear changes is there, nucleomegaly, okay, any reactive changes is there, that also should be mentioned. And any epithelial abnormality, both in the squamous component as well as in the glandular component. If it is there, it should